Okay, welcome to Health Talk here on AM 1270 and 96.5 FM KXBX. Paul Thomas, Bill Kearney in the studio, waiting for the impending storm to come and wash us all away. It's supposed to be
excited.
Yeah,
I actually went out and watered on Sunday and fertilized. So we're in desperate need of the more rain, and I assume it's going to be a fairly substantial.
It said it could be up to 3 inches of rain over the next couple of days. So. And snow in the higher elevations.
Yeah.
And, possible. I saw possible thunderstorms and hail, small hail. So yeah, it's gonna be kind of one of those weird storms, I think.
Yeah, that's not good for. I mean, a lot of the blossoms are coming out on the trees now and everything, and the leaves. And you sound like you're a little under the weather.
Yeah, you can hear it in my nose, and it just came on last night. Like literally, I went to go draft my Little League team. And was at the house of the president of West Shore Little League for 2 hours, 2.5 hours while we picked the kids for our teams. And the moment I walked in my door, it was like I just felt it in my sinuses, just the pressure and then by the time I was ready for bed, I was already blowing my nose, and so I took some Benadryl and some of my Flonase to kind of try to open my passageways up, and that helped a lot. It got me to sleep, but I didn't take any this morning. I didn't want to be drowsy at work or anything, and so I didn't take any this morning, and it's just been building and building and building, and then my stomach wasn't feeling too well either. So I don't know if it's allergies or if it's a bit of the flu coming on. I know that everybody in my family's been sick over the last couple of weeks. So
yeah, it's really going around right now. A decongestant would help you also, and the Flonase, of course, acts as it's a steroid, but it acts as an anti-inflammatory to open that up. That doesn't make you drowsy, but the Benadryl certainly would.
Sure. Yeah.
So
I slept really good. I mean, the Benadryl, helped me sleep quite a bit, but. I wouldn't do well if I took it and went to work. I'm already fight the dozing off syndrome as it is.
Well, I should have taken the Benadryl. I slept. It was 2:30, and I get up at 5:30, and I thought this isn't going to work very well.
No.
But they changed my physical therapy to 8 in the morning, and so I had a lot to do to prepare for today's show, and some exciting things I'd like for you to talk about in the very beginning about what we're doing with the radio show.
Yeah, we've actually gone ahead, and if you go to our website for AM 1270, which is just simply KXBX.com, on the right-hand side, if you just scroll down just a little bit, you'll see a picture of Bill, and he's got his headphones on, and he's talking on the radio during one of his shows, and that is our new link that we put up there for the Health Talk with Bill Kearney, and so you click on that, and it'll bring you to his Health Talk page. He's got information on there about both of his locations, phone numbers, addresses, and website information, so you can get to his website. Also on there is the information about the new Healthy Kids Free Vitamin Program that you'll be having out there. And in fact, if you click on where it says that, it'll bring you to your website, where Northlake Medical Pharmacy. It looks like you got a whole new revamped website on here. It looks different from what I was used to. And in fact, I thought this must be a fraud because it wasn't the old one, and you hadn't mentioned anything. And I thought, what are they doing? But in fact, it's there. And scroll down a little bit farther, and you'll see Bill sitting in the commanding chair with the headphones. And coming soon, we're going to have podcasts of all the Health Talk shows. So if you miss one, we're going to post up to, I believe we can do up to 10, something like that, 10 at a time. It depends on spacing, really. And so if you miss one, you can go back and listen to shows of the past. We've been recording them since, we've always recorded them, but we never really kept them here. They always went home with you. But we've been keeping them in-house since the first of the year. So we've got a good library waiting to go.
Well, I want to thank KXBX and Bicoastal Media for taking that effort. It really is a professional looking job, and it's something that we've long needed to do. And I appreciate with the exception of the guy with the red shirt on, it looks pretty good. So,
well, if you recall the first picture I took of you, I just did it real quickly, and your eyes were kind of closed. And you looked like me. You looked like you were sleeping at the mic. And I showed it to George, and George said, "What are you doing? You can't post that." So I took a couple more. I don't know if it was last week or the week before, but you're alert and smiling, and I think it's a good picture. I think it looks really good.
Well, we're going to be talking about your health today. Our number is 263-5252. If you have any questions about anything we're talking about, a lot of different things we're covering, medication therapy management. We want to talk about the Healthy Kids program, free vitamin program again, about some negative information about a very popular class of drugs, PPI, proton pump inhibitors, that significantly increase risk of dementia in the elderly. I read this article, Paul, in a little bit more depth, and the strange thing about it was the older you get, the less this affects you, which seemed unusual to me, because it would seem to me because the older you get, the longer the more apt you would get dementia. But as far as the PPIs causing it, for those of you who don't know what PPIs are, it's a popular class of heartburn drugs that's really works to keep acid from being produced. We have what we call H2 blockers, which are the things like cimetidine, Tagamet, Zantac, and Pepcid, and those which actually block the production or block the acid from entering the gastrointestinal system after it's been formed. And then we have the regular old-fashioned Tums and Mylanta and Maalox, which are a coating mechanism that will help delay the acid from absorbing into the gastrointestinal system. And the most popular thing are the PPIs, and those are called proton pump inhibitors, which are things like Prilosec and Nexium and Prevacid and Acifex, Protonix, and that actually stops the acid from being produced. A huge study was done in Germany that was published by the American Journal of Neurology, the Journal of American Medical Association, and they found that patients who regularly used an antacid known as proton pump inhibitors were 44% more likely to develop dementia compared with patients who were not receiving those medications. Now, if you get into the study, there were a lot of things that weren't eliminated as being the causes, such as getting older and other kinds of medications that you're taking with it. So dementia refers not to a specific disease, but to a large group of symptoms that are caused by disorders that affect the brain, such as Alzheimer's and a stroke. This German study connecting of PPI use and dementia risk is in association rather than a cause and effect relationship. So it was quoted at the end of the article, don't change anything that you're doing right now. It doesn't tell us anything that should change medical practice at the time. They don't think there's going to be an uprising among doctors telling patients not to take their PPIs. It doesn't rise anywhere near the level of evidence you would need to go that far. It's something we should probably tell our patients when we're prescribing the medication, or the health practitioner, or the physicians. But would you take the risk? And this is, we go back to the same thing that we've talked about many times, and it's risk versus benefit. And I have to tell you, my heart is heavy today because I lost a friend yesterday, and he was 69 years old, and he died of a heart attack in his sleep. A week ago Sunday, I had just taken him and his wife across the lake and been to our Super Bowl party, and he's gone. And you never know when something like that's going to happen. You know, like I said, he was 69 years old. Healthy, had some cardiology issues, but not that we thought were so serious. And one of the things I talk to my patients about when I do consulting a lot is quality of life. And, you know, we can get to the place where we we're so enhanced by the medication, and I'm a pharmacist, that dispense medications, that we're so afraid to live our lives that we don't take the risk. Now, nobody knows how big that risk is. I was just talking to another health professional this morning that was delaying seeing a health practitioner because he was too busy. And he had the symptoms, and I think a lot of us in our age group, I'm 73 years old, think that, we've been healthy all our lives. We're going to be able to survive. And the average age of a male surviving in the United States is 78 years old, and I think a female is 81. But you have to live your life, and many of us, because of medication, and I'm not associating this with my friend, don't take the medication or do take the medication and don't change our lifestyle because we don't want to change. And many times we feel like the medication is going to make it okay and not change our lifestyle. Eventually that catches up to you and up to us. And also it becomes a difference of how are you feeling? How do you, are you depressed? Do you feel like there's no hope for you? Do you want to go out? And this individual enjoyed every minute of his life. I will tell you that. Maybe at a cost. But we all have to do that risk versus benefit. I love this gentleman dearly, and I'll miss him. And we all at some time get to that point, and we don't always know when that point is. And maybe it's best that it happens the way I lost my friend. But we have choices in taking medications, and I think we're so wrapped up in medicines taking care of us that we fail to think about maybe our lifestyle needs to change a little bit too. And then we get these investigations from the insurance company saying, why are you taking this and why are you taking that? And it's multiple therapy for treating the same thing. And then we have to apply to your insurance company, or you have to apply to your physician about giving you too much medication. We had one yesterday that was on 7 or 8 different medications, and 5 of them were for high blood pressure. And she had a stroke. And at each time, the physician had ordered more and more medication for her just to control her blood pressure. And it was keeping it down, but the insurance company didn't like having to pay for that much medication. I think it's correct that an insurance company monitor those kind of things, because many times you're seeing a cardiologist, you're seeing an internist, you're seeing a family practitioner. They're all giving you a drug, and maybe some of them should be discontinued for multiple therapy. Our job is to catch those things. I have offered in the 36 years I've been practicing in Lake County to, at any time, for you to call me at the pharmacy at 263-1328 and ask me to go over your medications with you. Bring in all your over-the-counter medications that you're taking. Bring in everything you're getting from mail order. I don't care where you get your prescriptions. Just come in and let me review them with you. And I can see if you have duplications or have questions about the integral part of your medicine management. And nobody has time to do that anymore, so we have a tendency to, as clinicians, to say, just refill all your prescriptions for a year. You may not have all the prescriptions down there as a clinician because they may go to somebody else also. And we've just renewed everything for a year, and you could have duplicate medications. You could have 2 forms of digoxin, 2 forms of thyroid, 2 different kinds of antibiotics. You should have none of these things left over. So there's a reason they're in your medicine cabinet. Some of them have expired. Bring in the expired medicines too. This is no cost to you. Just let me do that for you. And I'm not going to tell you where to get your prescriptions filled. I'm not going to tell you can't go mail order. I'm just going to look at your medicines and see if there's any interactions with the things that you're taking that could be a problem and help you clean out your medicine cabinet. We used to have what we called brown bag days, where you would just bring everything in a brown paper bag, and I'd lay it on my desk and go through everything with you. We can call it anything you want to call it, but that service is available at Northlake Medical Pharmacy at Bruno's, number 2, and I will do that for you. So you need to get the best drugs and the least amount of drugs for whatever that we're treating. So as we've talked about before, there's a lot going on with the way people are taking medications and the kinds of even the kind of genders that we're giving medicine to. Diabetes in a woman's heart, for example, women with type 2 diabetes are twice as likely as diabetic men to develop coronary heart disease. With early and more deadly heart attacks, at least 2 hours of weekly exercise and medication might help lower the risk. We're not asking about, we're asking about things like I'm asking of Paul. Do a little bit of exercise. You don't have to do a lot. I worry about my friend across the aisle from me here, and and it's so easy to get wrapped up in what you're doing with the schools, with your family, with your job, and you don't take time out to take care of yourself. And I'm going to get to him one of these days. Because he's too good of a man to let this stuff take advantage of him, and it's easy to do. I have fought weight all my life, and I don't have the height that Paul has. I mean, you put that extra weight on me, and my knees are collapsing, and it's harder and harder to immobilize myself and get someplace without huffing and puffing. So one of the things that are prevalent in today is testing, and a lot of unnecessary testing goes on, and with so many people being uninsured, that's a huge expense that you may or may not have to be burdened with. And when it's warranted, of course, all of those x-rays and all of those tests are needed. But for example, when a chest x-ray before surgery, if you're having your arm operated on or your shoulder operated on, is it necessary to have a chest x-ray before you have surgery? When it is warranted, an exercise stress test may be necessary if you have symptoms of heart disease, such as chest pain or shortness of breath, because of high blood pressure or cholesterol levels, diabetes, smoking, or other risk factors. We are having tests on the 24th of February at our pharmacy from 9 to 1 for cholesterol tests, for bone density, for LDL, HDL, cholesterol management, and there's a fee being charged, but you don't have to go through your insurance company or the hospital to do it. When a chest x-ray before surgery is necessary and you have a history of heart or lung disease, you should also have one if you're over the age of 70. So, and I'm not sure, I guess, in addition to visits to the doctor, you're certainly at a much higher risk for pneumonia, which can be picked up in a hospital setting. CT scans for headache and concussions. In most cases, a neurological exam that includes questions about the inquiry and symptoms can determine whether you or your child has had a concussion. You expect a CT scan only after a car crash or a fall from a bike, a serious accident. And they mentioned for headaches, imaging tests may be appropriate if you have unusual symptoms. I have a patient who has a young son that has migraine headaches, and they come on, they don't know what the trigger is. They don't know how to control it, and each time they take him to a practitioner, they give him some ibuprofen and tell him something's wrong, but this should take care of it. Well, it doesn't. In a case like that, I think they need a CT scan. Carotid artery and ultrasounds, again, the benefits of the test outweigh the risk if you have a history of a stroke. I have a patient right now that's 95% occluded in the left side and 85% in the right side of his carotid arteries, and needs to have a stent or something put in to get rid of that blockage. But there are tests that you really do need, and they're not really expensive, most of them. A blood pressure test, which is a reading of your upper and lower blood pressure. Everybody needs that at least every 2 years and at least annually if your readings are 120 over 80 or higher. You buy your own blood pressure cuff or go to a fire station or one of our pharmacies and we'll take your blood pressure. But you need to know where that is. And that's why they call hypertension or high blood pressure the silent killer. You don't necessarily feel any problems with having high blood pressure. There aren't really any symptoms. Cholesterol test, which is a blood test to measure the HDL and the LDL, which is the bad and good cholesterol. Most men who should start at age 35 and women at 45, unless you have a high blood pressure history of heart disease or other risk factors such as smoking. They usually begin about 25 and 35, so every 3 to 5 years depending on the results. If your results are high, you need to go, for example, if you're going to our place to have a cholesterol testing and you're out of the range, you need to go see your family practitioner. A diabetes test, which is a fasting blood glucose test, and an HbA1c. People who have high blood pressure or high cholesterol, plus those who are overweight or obese, they say every 3 years. I think if you're in that category, it needs to be at least once a month. And you can get prescriptions for monitors and test strips, and if it does show high with your glucose level, then you need to go see an internist or an endocrinologist or just a family practitioner. A colon cancer test, which is a colostomy, and it's examine the entire colon. You just went through that, didn't you, Paul?
Yeah, I didn't have the actual colonoscopy, but I had they did the exam, yes.
And you can have examined the lower third of your colon, or at least a stool test, people from 50 to 75, or if you have symptoms. If you have bleeding or gastrointestinal symptoms, I had, that's how my colon cancer was discovered in 2003. And colonoscopy every 10 years, a sigmoidoscopy every 5 years, plus a stool test every 3 years. Unless they found cancer now, I have to go back every 5 years and have another test. A mammogram, which is another test that females need, women age 50 to 74, women in their 40s, and those 75 and older should talk with their doctor to see whether it makes sense for them. Every couple of years, and they can actually test for an enzyme that's in your system, whether or not for uterine cancer or cervical cancer at the same time, and pap smears, which are an analysis of the cervical tissue and the HPV virus, and women from 21 to 65 need that every 3 years. A woman can go up to 5 years between tests if they have HPV testing along with their pap smear. So the truth about all those testing, when I had broke my femur and I was admitted to the hospital and they had me taking all these tests, to be honest with you, I had no control over what they were going to do. If you're in a situation where you have a broken bone and you're in a lot of pain, or a car accident, or anything where you're inhibited somewhat by the medication you're giving, you really aren't alert enough to make any decisions about that, about what you need or what you don't need. And many times it's outweighed by the medical profession, and they're going to do it anyway. But I've said many times we need to be more aggressive about our health care and what we need to do in order to have more control over our health care. So we're going to take a break, and when we come back, we're going to talk about what you may not know about your medicine. Did you know that according to the American Heart Association, heart disease is the leading cause of death among men and women in the United States? Hi, my name is Bill Kearney, pharmacist and owner of Northlake Medical Pharmacies. The good news about the heart is that a healthy lifestyle can prevent the vast majority from the disease. There are risk factors that you can't change, such as being male, being older, and a family history of heart disease. But other risk factors that you can change. Smoking. Do you know that 30% of all the deaths from heart disease are directly related to smoking? High cholesterol. cholesterol. Limit your fat intake and limit intake of cholesterol. Increase your intake of vegetables and fruits. Exercise routinely and drink 32 to 64 ounces of water daily. When these things are done in combination, they can drastically reduce your chance of developing heart disease. While these procedures are very important for people with risk factors, they're even more important if you've had a heart attack. North Lake Medical Pharmacy with 2 locations for you, and now free delivery to Lakeport, Nice, Upper Lake Lucerne, and now Kelseyville, the Rivieras, and Buckingham.
My sister Katie and I love to shop.
Well, mostly window shop.
She means we're thorough.
She means we're bargain hunters.
Exactly.
But my sister Kelly showed me an article that made me change a really bad habit.
Just wanting us to do what's right.
You see, at one time, I just couldn't stay away from those bargain knockoffs. You know, the handbags and scarves sold on the street.
Counterfeit merchandise?
Ooh, you make it sound so illegal.
Well, it is stealing.
Ouch. I wouldn't steal. I didn't realize that this sort of stealing can lead to more Americans losing their jobs.
So, no more buying fakes and knockoffs, right?
Right. Just honest bargain hunting.
Now you're talking.
Remember, counterfeits hurt, but you have the power to stop them. To learn more, go to www.ncpc.org/getreal. That's ncpc.org/getreal. Brought to you by the National Crime Prevention Council, the Bureau of Justice Assistance, U.S. Department of Justice.
Vaccine-preventable infections kill 50,000 American adults each year. That's more than HIV, AIDS, breast cancer, or traffic accidents. I'm Assemblywoman Fiona Ma from California. On behalf of women in government, I urge you to talk to your doctor about the vaccines you need from birth through adulthood. You can protect yourself. To learn more about vaccine-preventable diseases and infections, please visit www.womeningovernment.org. That's womeningovernment.org.
This is a test to find out if you know it all when it comes to children. Time starts now. Name one of the leading killers of U.S. children age 1 to 13. What's the best way to protect children in a car crash? At what age and size should a child start using a booster seat? Where can you find the answers to these questions?
Car crashes are one of the leading killers of U.S. children. Many of those deaths could be prevented by making sure that kids are in the right seat for their age and size. Don't assume you know it all when it comes to car seats for your child. Go to safercar.gov/the-right-seat and know for sure. That's safercar.gov/the-right-seat. Brought to you by the National Highway Traffic Safety Administration and the Ad Council.
Okay, we're back.
All right, before we talk about what you may not know about your medicine, I printed this article out because I was looking on CDC, which is Center for Disease Control, and there was an article about why so many high school students in Palo Alto have committed suicide.
I've seen that.
And
with the trains, too.
With the trains. They either jump off buildings or they jump in front of trains. And the reason it interested me is because I used to manage a Walgreens store right in downtown Palo Alto. And most of my employees were siblings and offspring of people that lived in very wealthy parts of Palo Alto. And there has become an epidemic in the way that these people have kind of organized a memorial and seem to hail from all over the country that has become known for its affluence and technical ingenuity and the number of kids that have been pushed to the brink. And over the course of 9 months in 2009 and 10, 6 Palo Alto teenagers committed suicide. Between 2010 and 2014, an average of 20 children and young adults died of suicide in Santa Clara County. The deaths in Palo Alto constitute 2 recent suicide clusters, which is multiple suicides within a short time frame, of which an average of 5 in the entire country each year, having 2 in the same city, less than a decade is extremely rare. The students died on the tracks, but also by hanging, jumping off a roof or an overpass, Each time it happened, their classmates mourned them, and their distraught parents sought answers. You know, my experience with my employees in Palo Alto was quite unique. I have managed Walgreens stores all over the United States in 8 different states. And in Palo Alto, it was much different. I had a hard time motivating my employees because they were working because their parents said you needed to have that experience. If you told them to clean the bathroom or mop the floor or work behind the counter, almost always there was a rebuttal about I was hired as the cameraman, I was hired as the cosmetician, I was hired as, and it was a union shop as well, and they would go to the union many times if they were asked to do something similar that wasn't on their job description. What they failed to realize, what on their job description at the very top, it said that you would do things as required by management, and that management itself was delegated to do also. And if management did it, you were expected to do it too. Many times I cleaned the bathrooms down in the basement of 300 University Avenue in Palo Alto. Many times I mopped the floor. Many times I took out the garbage. We still do at our pharmacy today. Those kids, some of them didn't even make the 6-week trial because they refused to do it, no matter how skilled they were. They were very, and I don't mean all of them, but it certainly was the trend there. And all of them seeked motivation in order to accomplish something because they'd been given so much. They had no wants. You know, their wants was to keep the parents off their back, so they were trying to work. But their parents would support them if they had a problem with adapting to the company policy. So when I read this article, I thought, over the years I've been in contact with a lot of children, and including what we all do with our own children. I didn't have warm clothes. We didn't have meat except food that we got off the land when I grew up in Iowa. I went to work at 9 or 10 years old because I needed to make money for myself. My father set up a charge account for me at the local clothing store, and I was required at the age of about 11 or 12 to start buying my own clothes. I didn't have a good relationship with my parents, with my father. I did with my mother. Because in addition to that, I was beat frequently. But I did learn the value of being productive and having a sense of loyalty to the people that I worked for, and have some idea of what a successful person was going to be. So it is it's something that we fail to really teach our children today in the schools. The problem, I just saw, I was in physical therapy this morning, and I saw this girl beating up another kid in Oakland.
I've seen that on the
and I didn't hear any of the audio, so I don't know why that was happening.
They didn't really give any audio. I guess what I saw, if it's the same video, was that it was a girl that beat up a boy.
Yes.
And she was using like MMA style tactics, like kneeing him in the face and stuff, and body slamming him. And she was littler than him, but he had been saying bad things about her on Facebook. And so she went to confront him, and there was really no audio on that I saw, but it was just, she quickly disposed of him, I guess, if you want to say it that way. And everybody's kind of blown up about it because it was a girl beating up a boy. And of course, because it's, again, these videos that you see on Facebook go viral. And I guess that the police or somebody tried to get Facebook to remove it, and they refused to remove it from whatever. So, and it was a MMA fighter who saw it and reposted it, and that's why it got so big, because he had thousands of followers or whatever. So,
well, that's the kind of world we live in.
We live
today.
in that world now. It's weird. And Bill, I wanted to just kind of mention that when I grew up, I grew up in West San Jose, which in no way was affluent, but it was upper middle class. I mean, at least for San Jose's sake, and near the cities of Campbell, which is getting nicer, and then of course Saratoga and Los Gatos, which are really nice upscale, upper class cities. And I found that, kind of similar to what you were saying, because my school was actually in Saratoga, and I worked in and around that area when I was first going to work. I was working because it was going to give me the opportunity to pay for my car and go out with friends and have some money to buy things and stuff like that most people would work for, and I still lived at home with my parents and didn't have any wants that way, but I had friends that were from rich families that had never had to have anything done for them, given brand new cars, had a charge card to Macy's. Don't
Sure.
joke, these are teenage kids having charge cards to Macy's, and when they're 16 years old, and just whatever they want, go out and buy themselves new clothes. This is a girlfriend actually, who had her own charge card, but brand new car bought for them, and never had to work. And then it's funny because later on, a couple of years later, I was working as an assistant manager for Pier 1 Imports, and we hired a friend of mine who was one of these rich kids, and they were, like you said, the worst employee of everybody in there. Just lazy, just self-entitled, never wanted to do, anything, just wanted to sit around and be there because that's what they felt like they had to do. And it was kind of weird because I'm like, as a kid, you don't really, I guess, understand the dynamics. But my thought was, gosh, you got a job, man. You should be grateful. You're making money. And I guess I just didn't realize that they didn't even need to be there. They had everything they needed for
Well, this is a little bit of tidbit for you. My next door after Palo Alto was Saratoga and Payne.
Oh, there you go.
Yeah.
Okay.
So,
yeah.
But it wasn't nearly as bad.
No, not nearly as bad there. In fact, that's right where I grew up.
Yeah.
But the whole I went to Prospect High School, which is right there.
Right there,
so,
yeah. Okay, well, we'll get back to your health here, 263-5252. If you have any questions about your health, your prescriptions, doctors sometimes prescribe drugs that are for unapproved uses. And is that a safe practice, or can it pose needless risks? There are times when off-label medications are really the benefit. And certain drug companies might legally promote off-label uses to healthcare practitioners. In recent years, firms have racked up billions of dollars in fines as a cost of doing business. And that's because of using these off-label things and the reason that they don't get a second diagnosis for, it requires a whole nother series of $1 billion worth of tests. So, is your doctor in the dark, or does he know when he's prescribing these things? And most of the time, they do. I can go to a really old drug, which is a beta blocker called propanolol. Its brand name is Inderol. It's a beta blocker used for high blood pressure. It is used many, many times for stress-related stage fright, those kind of things. And a lot of the beta blockers are. There's a drug that's also a beta blocker called altenolol or tenormin, used for essential tremors, which are tremors that occur as you go through the day. And the more of a labor the day is, the more the tremors develop. So is it legal? Probably not, but it's well accepted in the standard of practice. And the biggest one I know is gabapentin, which is Neurontin. That was brought out for seizures, for epilepsy, and very, very successful. But its number one use today is neuropathy, diabetic neuropathy. And any chronic kind of an injury that has pain, and it works on the nervous system. So there are drugs, just to name a few, quinine sulfate, which was really for fever and malaria. It was used for nighttime leg cramps, and then they pulled it off the market. They have it back now as an extremely expensive drug, which is not. But as another indication, they have caused it to be more expensive. Klonopin or clonazepam, which is an anti-anxiety medication, is used for insomnia and restless leg syndrome because it's a long-acting benzodiazepine and it lasts through the night. And some people just take it at bedtime. Gabapentin, which we just talked about for diabetic neuropathy. Trazodone, which is actually an antidepressant, and it's the most sedative of the old antidepressants, but it's used for insomnia and anxiety because it's more sedative as well, and that's fairly well accepted. And Seroquel, which is a antipsychotic medication, is used for dementia and obsessive compulsive disorder. And we get into a lot of these antipsychotics that are used for more, and the only thing I have against those are that it becomes extremely, they alter brain movements, and they can change your brain chemically to be different than what it has. So these off-label prescribing can sometimes be useful for treating people outside an approval thing that your insurance company has. And doctors may want to take advantage of an emerging use of a drug that's with limited options. Off-label use of cancer drugs, for example, is quite common because they work on some different kinds of tumors. And there's good evidence behind certain off-label uses of anti-seizure medication, topramate. It's been used for migraine headaches, treating alcohol dependence. The non-steroidal anti-inflammatories typically, and some of the older antidepressants like amitriptyline are used as an adjunct, which were the old antidepressants, but they're used as an adjunct to pain medication to help alleviate the pain. So before you take a new drug, ask your doctor or pharmacist for if that's what it's really used for. If it's not, whether the use is supported by well-designed trials. And I know most of us, when we go to a physician, we don't really save up our questions to ask them, and they're in a hurry. And if you go in and you're supposed to be going in for a cardiac problem or a stomach problem and you bring up another issue, that's another appointment because this is what we're dealing with. This is why you made the appointment. And they won't talk to you about your other situations. Paul, you've been in that position before.
Yeah.
And that's why I say you have to fight. You have to fight for health care today. And it'll be fewer and fewer physicians and more and more health practitioners. You'll see people like CVS opening these clinics all over that have no physician in them. There'll just be a physician's assistant or a nurse practitioner. A physician probably won't even enter that clinic except to sign some paperwork, and you never see them again. So then you wonder, if I have a really critical problem and I don't know what's wrong with me, what do I do? And in that case, you have to, and the local hospitals wouldn't be happy with me saying this, but you have to go someplace where there's an expert. When we're rural hospitals like this, I know Sutter Lakeside is doing their best to be highly involved with cardiac care, which is a good move in this community, and have the right kind of equipment. I just see they added a new piece of equipment for the cardiac unit. But if you really need an expert in a field that we aren't here, we don't have an expert in this field here, then you need to go to Stanford or UCSF or CPMC or Sutter or Santa Rosa, one of those places that those experts are there, because there's a limited amount of tests that you can do here, and you have to be the one to ask to go. If you've been in there multiple times for a condition and they say there's nothing wrong with you and you know there is, then you need to go someplace and make sure that happens. And I'm not bad-mouthing our health care in Lake County by any means, but I'm disappointed that we don't have any more physicians than we have here. When I was on the board of directors, we were recruiting all the time. The board is no longer present there, and so it's just an advisory board if they exist at all. And so we have these corporations coming in to provide health care, like orthopedic surgeons that are on a rotating basis that go from one hospital to another. I was a victim of that with my broken femur. I'm not a supporter of that, but rather than not have anything at all, I think we have to do that. It's, I'm on several committees throughout the county, and one is law enforcement. We're losing law enforcement officers rapidly because we can't afford to pay them what they make in other counties. We can't get physicians to commit to a rural area like this unless they're familiar with the area and they love the area and it's beautiful and they want to make it. But many times their significant others, their wives or significant others, don't want to live in a place that doesn't have the accessibility that a larger place does. So I think you have to take the best of both worlds. I love living in Lake County. I don't want to live anyplace else. But I know if I have a drastic situation where I really need help other than cardiac, and even cardiac, because we can't do open heart surgery or stents or angiograms and those kind of things here, then I need to probably go someplace else. There's only one of you, and like I say, I've had talks with patients in the past week about their quality of life, of things not going right and they don't know which way to go. I've never been old before. I don't know what it's like. I'm getting there, and I probably won't like what happens to me, but I want to stay as healthy as I can. I want to stay as informed as I can, and I want to help you, our listeners out there, as much as I can to get to that same place. And one of these days I'll be retired, and I'll probably be going crazy because I don't know what else to do, and I may not ever make that retirement. So I want to enjoy the life I have here, and you should be able to do that too. And taking care of your health care is one of those things. The last thing I'm going to cover, Paul, is something that a little off the charts here. It's about the color of your pee, and what it means.
Depends on the day.
Yeah. Well. And I just saw this article, and I thought, how many times have I wondered? When it's very clear, you've heard that drinking 8 glasses of water a day can keep you hydrated and important, but if it's important for you to drink that much water, but if your urine looks like water, you've probably overhydrated yourself. So it shouldn't be just completely clear. Pale yellow, consider this your toilet bowl goal. You should strive to have light yellow pee. Moreover, when between clear and the color of apple juice, you've probably sufficiently hydrated yourself. So don't worry if you drink more than that, but that's probably where it should be. If it's bright yellow, it's probably B vitamins. If you're taking any kind of vitamin and mineral and there's an excess of B in there, your urine will turn bright yellow, sometimes even a brownish color. That's the color of apple juice as it's darkest. And when you might assume if you're super dehydrated, it really means that you just have an extra concentration of urine, and you probably need to hydrate yourself a little bit more. Brown can be episodal and can be a problem. So if it's brown, be very concerned. You could be taking an antibiotic that would do that, especially if it's green, blue, or orange. There's a dye called phenazopyridine, which is an antiseptic that's used for urinary tract infections. And it's used for UTIs or bladder irritation. Your pee could turn orange, and that's a normal side effect of the medication. Pink or red is the same, although it could be blood, and you would know the difference between that. So don't worry if your pee is clear or pale yellow. That's what you want. Those other colors aren't necessarily a warning, but you can tell there might be something going on if the contrast becomes bigger. We'd like to remind you we have about 8 or 9 flu shots left. If you haven't gotten your flu shot, Get it now. If you've met your deductible, it will cost you nothing. If you haven't, it'll cost you about $15 to get a flu shot, and then that's all. We won't get any more until next year. Zostafax, Tdap, pertussis, all those shots we can give you without your physician's prescription. The Zostafax is for shingles. They're lowering the age now down to 50 where you can get it, and usually your insurance company will pay for it. You need prescriptions delivered. Remember, we deliver all over Lake County, Nice, Lucerne, Upper Lake, and Lakeport, and also Kelseyville, the Rivieras, and the Buckingham area. So give us a call, and we'll be sure and get that medication to you. Don't forget to look at our website and see what KXBX and Bicoastal Media have done to enhance our website. Remember the free vitamin program for kids from 2 to 12, I believe it is, and come in, fill out a application form. We'll keep your form on file, so every month you can get a free bottle for each of your kids, free of children's vitamins, and we'll be more than happy to have that program for you. So go on our website, look at kxbx.com, go down on the right-hand side and see North Lake Medical Pharmacy. Click on that. See our website and see what we do. We'll have podcasts available for you shortly, so you can listen to the old shows. Paul will have to do a extra show next week because I've got to be in Nashville.
Okay.
At a board meeting the week after that.
Okay, we can do that.
But I really appreciate what the radio station has done for us, and we'll look forward to seeing you in the future. If you want to save money on prescriptions, come see us. Many times we can beat the competitor. We just had a call from a store in Forestville and Guerneville that could no longer do HIV medications because the Sutter Select plan forced them to go to Walgreens. One time they could go to their regular pharmacy, and then they had to go to Walgreens for HIV medicines. In this county, that's going all the way to Ukiah. In Guerneville and Forestville, it's going to Santa Rosa to get it. So we'd like to remind you we're North Lake Medical Pharmacy with 2 locations for you at 5136 Hill Road East across from Sutter Lakeside Hospital. Call us there at 263-6192 and outside the Bruno Shops Mart at 347 Lakeport Boulevard. Give us a call there at 263-1328. Take care of yourself, Paul.
I will. I'm going to go home and eat some chicken noodle soup for lunch.
Attaboy.
Yeah, I'm going to try to beat this thing before it gets too bad. And for the rest of you out there, be sure to stay cool and warm and dry tonight as the storm is supposed to be rolling in. Could be heavy at times. And we'll see you back here next week, next Wednesday, 10 a.m. It's Health Talk on AM 1270 and 96.5 FM KXBX Lakeport.